Hey, welcome to Bryant Interviews. Joined today by Jamely, good friend of mine from City College. How do you see your last name again? Olaechea?
Or like, yeah,
Olaechea. So, uh, Jamely is a registered nurse, works in Kansas City currently. Kansas City? Is that
I work in Wichita, Kansas, actually. So it's like two
Wichita?
hours.
Ah, very cool. So, day in the life of a nurse, especially now during COVID season. What's it like?
Oh, horrible. We are so short-staffed, and there's not that many like ICU beds, especially here in Wichita. We have two major hospitals.
Okay.
One of them is the one that I work for, which is Via Christi St. Francis,
Okay.
and the other one is Wesley Hospital. It's like the competition, quote unquote. But yeah, like all the ICU beds in those two hospitals are completely full right
Wow.
now.
So there's a distinction, registered nurse. What is that distinction? Why do they say registered nurse and not just nurse?
Well, there's LPN, which is like licensed practitioner nurse,
Okay.
and that is like the step below being a registered nurse, to put it that way.
Uh-huh.
Uh, Not that there's anything wrong with being an LPN, but there is a distinction
Okay.
because registered nurses, there's actually even more of a distinction between them. If you want to get technical, there's the associates, which is the 2 years, and then there's a bachelor's, which is the
Okay.
4 years, which is what I did.
Okay. So you originally studied at City College and then moved over and continued your studies. What made you have that pivot between schools or geographic location?
Well, when I was in City College, I was actually thinking of majoring as a physician assistant,
Okay.
but program to get into physician assistant is very competitive, and I unfortunately didn't get in. So at that point in life, my dad was working over here in Kansas, and he
Okay.
told me that I'll just try my luck and nursing here in Kansas, and that's what I did. And I went to school here for a registered nurse, and I just stayed afterwards.
Very cool. So when you do so before the schedule, like is it just one really long shift?
Well, yeah, nowadays it is. Like in the past, like years ago, nurses had the option of doing like 8-hour shifts,
Okay.
like break their shifts differently.
Hmm.
Now it's just a standard of like 12-hour shifts. Day shift
Wow.
consists of 7 a.m. to 7 p.m. and that night shift is 7 p.m. to 7 a.m. But in all reality, I mean, when you go in,
Uh-huh.
you set a set time, but when you like when you leave, like there is no set time for you to leave because
Oh,
it takes about an hour to give report. So if on a good day, like you're leaving there like around 8 a.m. or 8 p.m. On a bad day, which is what I had like
wow.
a week ago, I pulled a 16-hour shift, and
Nice.
I didn't leave till like almost 11 o'clock in the morning, and I started at 7 p.m.
Wow. That's grueling. And at the end of the day, everyone in there is in healthcare. Like so you are more one-on-one with the patient, and how do you deal with the whole not transferring it to your family, friends, loved ones, and keeping everything separate? Like how is that procedure happening for nurses? Like PPE, protective gear.
Well, I mean, it's hard not to take your work to your home, but I have not dealt with COVID patients that much, like not one on one. I did last time I worked, but it's not like on an everyday basis that I go to work. There are friends of mine that do work with COVID patients like every time they go to work,
Wow.
and that is mentally and physically draining. Like I can tell you that that one night, which was like last Friday night that I worked with them, it
Uh-huh.
was probably the worst shift of my life in the sense of
Wow.
physically and mentally drained I was, because wearing that PPE is not the best thing.
Like
It's horrible.
it doesn't look comfortable. Like
It's not like, I'm not even kidding you. Like I used the face shield and like all the PPE Friday
like,
night, and it was like Tuesday of the following week, and it was still hurting my forehead.
Wow.
And that's only one shift of wearing it.
So like it's not part time, it's not just shift basis. Like if you're short staffed, how do they maximize that? Because it's like a state of emergency almost.
Well, right now my hospital is recruiting nurses, like travel nurses from
Okay.
other states.
Wow.
And they have started working with, like, COVID patients, and wherever there is the need, they just, when there's the need, they just like place them in whatever floor or unit they need it.
Wow.
Um, my unit, which is 4 Southwest,
Hmm.
it's a cardiothoracic step down unit.
Okay.
So I basically take care of post open heart surgeries and post
Wow.
thoracotomies, which is when they remove a patient's lung for because they have lung cancer.
Okay.
Those are the typically patients that I see, but we see a little bit of everything every day.
Wow,
Um,
that's intense.
yeah, like those are the majority of my patients, but my floor is pretty well staffed at the moment. But I
Okay.
know that there's other floors that are in like great need. And for
So
example,
wow.
I'm not full time,
Okay.
and I'm PRN. I'm what they consider PRN, which is like when they need me, they call me. But
Okay.
it's more of like when I can have the option of going, I pick up extra shifts.
Okay. So what inspired you to go into this field of healthcare? Because it's a pretty intense commitment. Yeah,
Yeah, it is. It's like almost like a lifetime commitment.
I can
But
imagine.
my dad is actually a retired doctor at the moment. But
Okay.
back when I was, trying to decide what I wanted to do with my life as far as career wise,
Uh-huh.
he was working as a psychiatrist here in Kansas, and
Okay.
I've had this like great interest in the medical fields.
Okay.
Probably because I grew up with my dad being a doctor and like him just telling stories of his patients and so forth. But my brother also became a physician. So it
Okay.
kind of runs in the family, the interests of the medical field. Um, and I always knew I wanted to do something in medical fields, and it happened to be nursing, and I'm glad it was nursing that I chose.
Wow. So there's a meme that was circulating around that said like if you attack a police officer, you get arrested. You attack a teacher, you'll get arrested. A bus driver, you'll get arrested. Cashier, you'll get arrested. But if you attack a nurse, management asks you like, what could you have done better? And I don't know how relevant or true it is, but I think it was something that I wanted to ask about.
It's funny. I hadn't seen that meme, but I'm sure it exists, and it's pretty accurate, honestly, because
Wow.
as sad as it sounds, yeah, like there's different types of abuse. Obviously, we all know the verbal abuse or physical abuse. I have never experienced. Well, I guess I should take that back. I have been hit in my hand by an elderly woman that was confused. It wasn't like she beat me up or anything, but it still counts because she shouldn't have like hit me. Nobody should be hitting each other for whatever reason. But
Yeah.
I guess that's like my story of physical abuse from a patient. But I've had several verbal abuse from patients,
Wow.
several, countless. Can't even remember how many.
That's kind of like how do you get past that discouragement? Like what mental state do you put yourself to be like, I'm still gonna just do my job and just carry on, so to speak.
Well, you also have to take into consideration like the reason why the patient is there, like what comorbidities they have, like what mental illnesses they may have as well. So it's trying to in the back of your mind just remember like, oh, it's because they're sick and this is the way that they're acting out. But
There's a
there's
lot of
been
compassion.
oh, endless endless compassion. That's what nursing really narrows down to, and if you don't have that, like, you're in the wrong field.
Wow.
But when patients do start acting out, like, we have the option of calling the
Okay.
security guards, and that usually helps because they have more of a male authoritative figure as opposed to a female. But even sometimes, like, security doesn't do the trick. Like
Yeah,
last time I had a patient that was, we have a lot of like, you
mm-hmm,
know, drug abuse patients,
mm-hmm.
and the security people like try to, talk to him to calm him down, and that still didn't do the trick. And he
Wow.
left without, the doctors discharging him, and I had to call 911 so that they can track him down.
Wow, that's
but but he eventually came back on his own.
okay. So when you so describe like a typical, how do you start your day as a nurse? Like, do you come in like the your scrubs already, or am I using the wrong um like
No,
uniform?
here in the US, like we go in to work with our scrubs, and the reason
Okay.
why I say here in the US and make that distinction is because my cousin, he lives in Spain and he's also a nurse.
Hmm.
And in Spain, what the way they do it is that they go in with their street clothes, and they change into their scrubs in the hospital. And when they leave, they have to like change out of their scrubs and put their street clothes. Which honestly, in my opinion, I think that would be the best thing to do, because you're not like transmitting bacteria and diseases, like, or carrying it around in your scrubs when you go in and out of the hospital.
Okay.
But the US, like, that's not how the way we do it. So when I go to work, yeah, I wear my scrubs,
Okay.
and I usually arrive like about 20 to 30 minutes before my shift, simply because I just like to get there
Hmm.
early and not feel rushed, and get my stuff, my assignment, write down my medications, like just get more organized and
Okay.
be ready to get reported around 7 p.m. And then when I leave, I just come home and take my scrubs off, like at the door, try to, disinfect myself as best as possible, and then jump in the shower.
Do, do, does the fear of catching COVID or giving it to your family members deter you from your job?
Determined for my job, not exactly, but there is always that fear, especially because my mom is autoimmune compromised,
Okay.
and I live with her, and I live with, my grandmother and my dad that are elderly.
Mm-hmm.
Uh, So there was a point when COVID started that I was pretty, scared like the rest of us. And
Okay.
um, I actually moved out of my house for
Wow.
about a month, maybe. I went to live with my friend that was also a nurse,
Okay.
and that was pretty tough, being away from them, being away from family.
Is like the so how hands-on are you in your day-to-day operations as a nurse? Like administering medication, checking, because I have a very ignorant, small-minded view of what nurses do because I simply don't know. So like what is it like? Like you blood pressure, pulse, medication, how
So when I like after I get report, right? Like when I get report from the day shift nurses, like we go in, both of us, we go in, and we put eyes on the patient. Like I look
uh-huh,
at them and make sure that they're breathing and they're doing okay, they're stable, from just me observing them.
uh-huh.
And after I get my report on all my patients, and I go and say hi to my patients and introduce myself, I basically start my night by trying to decipher which patient I'm going to see first. And sometimes it can be a little tricky because you are short staffed, and at night, and usually we have like 7 patients, anywhere between 5 to 7 patients. And that is a lot because we're on a time limit. If people want to go to bed, people want their medicine and just go to sleep. So I typically start my night by deciphering which patient I need to see first, which one has the greatest need. If a patient is in pain, then that's the one that I go to first. If a patient needs to be changed for whatever reason, and then CNA needs my help because there's not another CNA on the floor,
What's a
then
CNA?
that one is a certified nurse assistant.
Mm-hmm.
So um, if there's not another CNA on the floor to help her, then I will go in and help her change the patient. Obviously, because we don't want anybody to be
Mm.
soiled, laying in that for a long time. But when I go see the patients, I bring their medications with me, And the first thing I do is take their vital signs,
Hmm.
and then I, scan their bracelet, ask them their name and date of birth, make sure it's the right person that I'm giving the medications to. And then I scan the medications and I tell them what medications I'm giving them, and for the reason why they're getting these medications, for the most part, because some patients, they know exactly why they need it. Others they're new to these meds, so they ask, why am I getting this medication?
Mm.
And after I give them the medication, I do my assessment, listen to their lungs, their heart, their belly, their check pulses, check pupil sizes and stuff, just an overall assessment of the patient. And then I just move on to my other patient. And that's just the process of how the beginning of the night, the
Wow.
flow, how it usually is. And after that, then I just sit down and chart endlessly for several hours. And and then it's like the process starts all over again with morning meds.
It's really nonstop. Relative to, like, for example, doctors or other people, nurses spend more time with the patient than any other. Is that correct?
Yeah, that's accurate. Nurses are,
They're
they're
more hands-on. They're more involved. They're talking more, and they're the ones that communicate more with the patient, if I'm not mistaken.
nurses were, especially day shift, they're
Mhm.
more of like mediators. Sometimes we're the middlemen, and
Okay.
it shouldn't be like that, honestly, but it comes down to that because we're the middle person, where the patients tell us something and then we tell the doctor and then the doctor tells us and we tell the patient, like that kind of thing. But
Playing telephone.
yeah, like playing telephone. And sometimes we're the middleman between several doctors,
Wow.
because doctors are not the greatest at communicating with each other. So we have to step in and communicate the patient's needs to them and make sure that those needs are being taken care of. And like you said, we're there like all the time. Like the doctors, honestly, they come in and they're maybe there like 5-10 minutes max, if at all. Max, yeah. And then they step out and they just go see their next patient.
That's definitely true, because like when my grandmother went to the hospital, the only person I talked to was the nurse. I was like, wait, there's no doctor there. And then on the board, it's like the number is like the nurse's number. So I feel like when I think of healthcare and I think of the person that's most involved, I think nurses in terms of their presence. It's very known. It's a
Hmm.
lot more pronounced. And so when people, what would you say to people that are like thinking like, hey, I want to be a nurse in the future? What, like, when did you decide you wanted to be a nurse, and how did that shape you in applying, preparing, school courses, internships, so on and so forth? If there are internships.
I don't think I decided that I actually wanted to be a nurse until I was in college. Like when I was a child, I told you I wanted to, something in the medical field, but I just wasn't sure exactly what it was.
Hmm.
And when I was in college, and living here in Kansas, my grandmother, she had Alzheimer's disease for a very long time, but towards the end, it was, obviously progressing, getting worse. And here we put her on hospice, unfortunately, and then we had an awesome hospice nurse that she would come out and see my grandmother, and I was able to, like, talk to her one on one with the nurse, and I just saw like how caring and loving and compassionate she was towards my grandmother, and I just wanted to be able to provide that to somebody, to some patients of mine. And she basically was the one that inspired me ultimately to become a nurse.
That's pretty. That's pretty intense. Like, did you also have to do like I know medical students, they do MCATs. Is there anything like that when you apply for nursing school, or?
Oh no, we don't take the MCAT is prior to going to medical school for
Okay.
like we don't have a, well, I take that back. My school didn't have it, but there are other schools that I know of in Kansas that it's called the TEAS test,
Hmm.
and it just basically consists of like English, science, math, Yeah, I think it's those three subjects. And they just test you on those things. And if you pass, then you can get into that school's nursing program.
Okay. So what do you do to keep like a balance between like I'm not going to nurse like 24/7. I have to do something to enjoy life because I'm also a human being. What kind of things do you do just to be like, you know what, I'm going to have fun in life? Or nursing is also fun because that's a passion of yours and I don't want to like separate the two, of course.
It is a passion of mine, and I don't see myself doing any other type of career.
Mhm.
Uh, but the good thing about nursing is that once you clock out, you kind of disconnect yourself in a sense,
Really?
because it's not like, you're getting calls at home. You don't get like physicians, like they're constantly on the go because even though they're not in the hospital, they still take calls whenever the patient's crashing or the patient needs some sort of medicine.
Wow.
Like once I'm out of the hospital, nobody's calling me for no reasons because I'm not the provider.
Okay.
At the hospital, I just take care of the patient, and that's it. But when I clock out, sometimes I do wonder, like, how that patient is gonna do throughout the rest of the day, and when I do go to work, like I'm just like, oh, like I wonder what happened with so and so. But it's just like the other things that I do for fun besides, hanging out with friends, which we can't really do much of that now because of COVID. It's very restricted. I like to watch Netflix. I like binge watch shows, and just like hang out with my family and my dog. My dog is like my greatest distraction and stress reliever.
Very cool. So
And
when you're there, um, so when you mentioned like wondering how the patient's doing, like how what happens? Do you build a sympathy or relationship with the patient, and then like if something happens to them negative, like they didn't make it or something like that, we always have this drama in our mind because of American media, like patient passed away. How has that happened to you? And if so, how do you move forward? Like, how do you console yourself that it happens?
yeah, I've had several patients that when I go back to work, they tell me like, "Oh yeah, so and so passed away," and it's very hard emotionally because I mean we're humans. We tend to develop certain connection with certain patients. I'm not saying all, but there are a few special kind of patients that we connect with, and there are we do have the option of talking to a like the pastor from the
Okay.
hospital. We can just go and talk to them if needed. The hospital also like provides um, psychological help for those who need it as well for whatever reason. But between my coworkers and I, we just we talk about like basically like, oh, like they're not suffering anymore, which is what nobody wants their family member or patient to suffer. So that's like basically like the way that we console ourselves too.
Okay. Do you ever get like pissed that people don't wear masks and you're like, wear your damn mask so there's less people in the hospital? Like, do you ever have that mindset?
I do get annoyed when I go out to like shopping when I'm in the outside of work
Hmm.
that people don't wear their masks because it's like you don't realize how bad it is. Like I guess it's not until you have a family member or someone close to you or you yourself experience it, you may not know it. Ignorance is bliss to some people. But for nurses and those that are in the healthcare field that we are actually seeing the outbreak of COVID and the effects that it has, like it's very frustrating when somebody tries to undermine it.
Because it's like I feel like there's a lot of societal like cumulative effort. Like if you go out, some responsibility because you don't know the effects that you have. Like you'll catch it, but asymptomatic, is that like a common occurrence that people test positive for COVID, but never in their life would even imagine that they had it.
And that's what I hear. I'm not too familiar with all
Okay.
this and all that stuff, but um, I know that there have been people that are asymptomatic with COVID, being COVID positive. And
So
go ahead.
there's always this like when COVID first started, like if I watch the Chinese newspaper, they show you just a bunch of people on ventilators, and they show you like it doesn't look good. It looks like terrible, and if they're on a ventilator, what looks like the probability that they'll get better or worse, or what determines that?
See, that's more of a ICU type of
Okay.
nurse. I haven't seen anybody on a ventilator because I can't go to um, the ICUs. I mean, I guess I could
Okay.
go, but I can't go to the COVID ICU because
Okay.
right now in my hospital, MICU, which is a medical ICU, is the one
Okay.
that is taking all the COVID patients. And because they are so full, there are some beds in the neuro ICU that are taking COVID positive patients as well. And the majority of those patients that are in the ICU, if not at all,
Hmm.
they're probably on ventilators.
It's actually interesting because like one of the comments I was making with my mother was like, with coronavirus, it's not like the other diseases stop. Like the other sicknesses and stuff, like people still get heart attacks, people still get strokes, people still suffer from other ailments, and this is just on top of that. So it's like not the most pleasant.
And that's the problem that we're encountering now because there's not that many ICU beds,
Okay.
and people are still having heart attacks, people are still having strokes. So those type of patients, if they're very complicated, they need an ICU bed as well.
So what are the general pieces of health advice you'd give people? If you were to give people like a list of like, this is what you should do, protect yourself, what would you tell them?
Pertaining to COVID only or in general?
Pertaining to COVID. We'll start with COVID.
Um, so obviously hand washing is so important, and that's the most important thing that we can do at work too. And keeping a mask on and wearing it properly, and just trying to stay indoors as much as possible. I mean, because I know here in Kansas, like people are just not too I wouldn't say too concerned, but they're kind of as time passes, it's out of sight, out of mind type of thing.
Hmm.
And people have been getting fed up with COVID. So there's
Hmm.
people that are going to like the bars and the clubs and just mingling or having parties when they shouldn't be mingling in greater amounts of numerous amounts of people. So just keeping those gatherings to a bare minimum with like the few people, that would be probably the most ideal thing to do.
What would about in terms of like the regular flu? Because like I just had my flu shot like a few weeks ago because I don't want to start sneezing and coughing because of the flu and then thinking that it's
And then it's
something
COVID.
else. So what's your stance on like care for like common cold, flu shots?
I've always been an advocate for, and there's people that don't like flu shots for whatever reason, but especially now, I think it's the most important thing to get flu shots because of COVID as well. Um, and like COVID is getting worse because it's flu season too. So there's we're seeing a little bit of both on our end here.
That's
But
not pleasant.
yeah, and like you said, it's like, oh, you don't know if it's a flu or COVID. But anyways, like my general advice is just getting the vaccinations that you need. In this case, the flu shot, and just trying to eat as healthy as possible too, as healthy as possible as well also. And if you can exercising or just walking for like 20-30 minutes.
Staying away from being completely sedentary. Like don't be a couch potato.
It's
Basically.
the hardest thing to do because because of COVID, we're just staying indoors, and all we want to do is just being couch potato. But I mean, we can exercise at home just watching like YouTube
Do you,
channels, yoga or some meditation.
do you ever watch like one of those doctor shows and like Grey's Anatomy, I've heard is like pretty accurate, but like a doctor show where you're like, you know, they would never do this in real life. Like this is, and get pissed off at that.
You know, you mentioned Grey's Anatomy, and I've seen a meme about Grey's Anatomy, how the doctors are getting a patient out of bed. And I'm just like, you would never see that. I mean, I shouldn't say never, but it's very rare. Like I've never seen it myself. Um, we nurses and the CNAs are the ones that get the patients out of bed. The doctors usually just come and tell us like, hey, this patient needs to be walking around or getting up, and we're the ones that enforce that and encourage the patients.
Very cool. So the scheduling, like I don't know if this is true or not, which is why I figured I'd ask you, is that I heard that some nurses they do like 4 days where they're like 12 hours a day for 4 days, and then they get 3 days completely off in a row. And is
Yeah.
that a common, like does that happen?
So full time is 3 days a week.
Okay.
But I know of certain people, like certain nurses, that they do 4 days a week,
Mhm.
it's 4 days straight. Sometimes some nurses, they do like 2 days and then they have a little break and then they do like the next 2 days within that same week. Like the good thing about nursing is that we have the flexibility of scheduling our own days and however we like our schedule. It's up to your preference. Like when I was full time, I did 3 days in a row,
Wow.
simply because I just tried to get my days done and like have the other days for myself. Because working night shift, it's even harder
Okay.
because you lose 2 days. You lose the day that you're working because you're trying to
Okay.
sleep when you to go to work, and
Wow.
then the day that you're done working, it's like a whole day that you're trying to recover. It takes me more than a day actually to recover, about 2 days now,
Wow.
because I don't do it that often because like I said, I'm just PRN. So as PRN, I only work one day every pay period, which is every pay period is 2 weeks. But like I said, I do pick up extra shifts. So I ultimately end up working like full-time hours. But
Do you
my
ever feel
body
like
is just not
burnout?
used. Yeah, and that's why I like being PRN, because if I'm, getting tired of working full-time hours, then I can just cut down and just work like 1 hour a week. I mean, one day a week.
Like 1 hour a week, like that's nuts.
But I actually heard one of my coworkers, he told me the other night that he did 9 days straight of
Wow.
working 12-hour shifts. I was like, oh, like my body would not be able to handle that.
No, it's like demanding because like it's physically active. Is that the
Yeah.
case? Like always on your feet, always going from point A to B.
Yeah, I wear my Apple Watch, and when I'm at work is when I get the most amount of steps.
Wow.
But it's pretty amazing to see like the amount of steps that you get towards the end of your shift.
Wow. Like how like do you ever get like in the movie they always dramatize like a code blue or a code red or something like that? Like how do the coding system work like when the patient needs help?
So there's two different things. There's a rapid response team, which is basically when the person, is still breathing, still has a heartbeat, but for whatever reason they're just declining. Whether they're just lethargic, meaning that they're not really like alert and oriented. There could be many factors why the person may be declining. Maybe their oxygen saturations are not that high. Like, we want it to be above 92%, but they may be like 85 or 88%. So, and if the patient is still breathing and alive, and they're declining, then we call a rapid response. And basically, it's when the doctors that are in the hospital, they come and they, lay eyes on the patient, and we try to determine as a team what may be going on with this person. And we get labs and determine what type of testing may be needed to stabilize this patient. And if need be, we can transfer them to an ICU, and if they don't seem like they need to be transferred, then we just leave them wherever it is that they are. But the other thing that you mentioned was the code blue,
Hmm.
which in my 6 years of being a nurse, well, close to 6 years, I've only had two code blues personally. I mean, I've seen many, but two of them were my patients, and that's when the person is no longer breathing and no longer has a pulse because of whatever reason that happened. Maybe they just had a heart attack or an arrhythmia, which an arrhythmia is just like a change in their heartbeat, most likely ventricular fibrillation. But um, when they're no longer breathing and they have a no pulse, then we call it code blue. And the doctors that are in the hospital on call, they come and like lay eyes on the patient, and we try also as a team to determine what may have caused this stop in breathing or heartbeat. And chest compressions, it's the most important thing to do when you have a person that's crashing. So it's important to start it early and do them efficiently. And sometimes, we have to give medications to these patients to bring them back. And sometimes it's just, sufficient with the chest compressions. It just depends on the patient and and what's going on with them.
Do you ever like as I got older and I read more about this, the whole concept of using like the electric thing to shock the person back to life, it doesn't really work like that in the movies. Is that correct? Like the idea of like they don't have a pulse or their heart's not working anymore, and then you have to shock them back to life. Is that like a thing, or is that over dramatic?
No, it is a thing. It may not be as dramatic as on the TV shows, but um, there's ADs, which is like the defibrillators that we put, like the pads that we put on the patient's chest,
Hmm.
and that machine usually talks to us. Sometimes it checks for whether or not the person has a heart rhythm, and it tells us like when it's appropriate to shock the patient. And before you shock the patient, the most important thing is for everybody to just stand clear, step away from the patient while they're being shocked.
So
And so
the other,
talking
what would you
about
consider is a stable patient in terms of like there's nothing wrong with them? Like, is there like a criteria for that? Like, no, like a healthy human being like is good to go, isn't really
to make it very general, because every patient is a different
right.
situation, different scenario. But a stable patient for me would be a patient that has a good blood pressure, good oxygen saturation, good vital signs, and like within normal limits. A person that does not seem like they are struggling to breathe. A person that has a normal sinus rhythm heart rate. Most of my patients, they're being monitored constantly as far as what heart rhythm they're in, because we hook them up to telemetry. Being a cardiothoracic floor that we are, most of them are in telemetry. So there is a person that watches their heart rhythm at all times, and I'm very grateful for those people because they're the ones that usually are able to catch when there is a change in rhythm right away. Um, Another thing that would be considered when a patient is stable is that they're actually alert and oriented, like talking to you, um, and yeah, and like good vital signs.
Because like we're all like out of it. Like I feel like the only exposure I get is Hollywood. So I'm like that's like no. The Hollywood also says you can walk around with gunshot wounds. So I'm like, yeah. So it's always like such a large debate. And so patient care, flu, how the family's doing. How do you keep in touch with friends and family, or is it easier because it's a digital age?
With the patient's friends and or
Like
my or
your
me.
own, like outside of the patient life. Like if you have like a
Oh,
long schedule, I'm assuming like you ever get like a really long shift, like 16 hours, and then people text you like 50 million times.
yeah, it's happened. And every time that I actually go to sleep, like that whether it's at work or when I'm, well, let me rephrase that. Every time that I go to sleep, I put my phone on do not disturb. And when I am sleeping, like trying to, prepare for work, I I go MIA basically from the rest of the world. There's it's hard for me to catch up with friends, and I try to respond, pretty quickly to messages. But when I am out of work and I have recovered, that's when I catch up with the
Mm,
phone calls and the messages that I had during the time period that I was at work.
wow. So so that's pretty much like your social life, but then you need a 2 day recovery to be able to get to that social life point.
Hmm.
Like a lot of people, I'm assuming they don't realize that a day off is not really a day off if you're burned out. Is that
And it's not a day off for a night shift person either, because you wasted a whole day during your day off
uh
trying to recover.
so that's definitely not fun. So if people decide nowadays like if you have a young individual or just someone that like has an interest in going into nursing, what would you tell them to ask themselves before they make that decision? And what direction would you guide them to go?
Oh, they should ask themselves if they have the compassion and patience enough to go into it, because in nursing, it's not all fun and how it looks in the movies. Like there, it takes a lot of um, it takes a toll on you emotionally and physically. So if you are passionate for it, then definitely go and pursue your dreams. Like it's very fulfilling at the end of the day. If you are in some way or another, doubtful, what you can do is maybe shadow, like do a shadowing experience, um, or or what I did actually before I went into nursing, I became a CNA. I became a certified nurse assistant. So I was able to see hands on like the role of what a nurse consists of. And that solidified my interest in nursing. So
That's
if you have
actually very
that,
important,
that's
actually,
a
that you brought that
positive.
up.
Mm-hmm.
Because it's like sometimes people don't know what they're getting into until they're in that position.
Mm-hmm.
And I'm like I heard the story about the person that was like, oh, I'm gonna be a doctor, but then the first day he saw blood, he was like he fainted or he can't do it.
Yeah, exactly.
So definitely it's a huge commitment, I can imagine, and you don't want that commitment to go to waste if you find out that maybe it wasn't for you.
Yeah, especially after going to school for that long and paying that amount of money. You're committed to that career. So any career in general, like after going through school and paying money, like you just want to be able to work in that field and actually enjoy it.
Makes sense. That's actually a very good point. And Jamie, I know that today was like one of your very rare days off. I want to thank you in advance for being here and being able to have this conversation. I definitely look forward to talking to you again about this in a less COVID centric world because I feel like there's going to be more less like I feel like it's overshadowing a lot of other things that went on because that's such a large focus nowadays. And
Hmm.
then yeah, thank you so much for being here, and I look forward to speaking to you again about this.
Now, thank you for choosing me and
Of
giving
course,
me the space to talk about my passion and what nursing is all about. And like you said, hopefully we can talk again when COVID is not so prevalent and taking over our lives.
absolutely.